Welcome to SSRI Overview Part 2. In this video, I'm going to go over the side effects of SSRIs as a class of medications. They share a lot of side effects in common because ultimately, at the end of the day, it's the serotonin that is causing the problem. It's too much serotonin because of the reuptake inhibition in the gut or in other areas of the brain where we don't want it. They're side effects because they're unwanted. The only difference between an effect and a side effect is one we're going for and the other we're not. And for some patients, some side effects might actually be welcome, and in that case, they're not side effects. So these are really just effects of serotonin and of these medications. So just as a class, probably the most common side effects are also the most general, the most nonspecific. So nausea. Any medication can make you nauseated. It's just the brain's reaction to a foreign substance, into a change in chemistry and a disruption of the homeostasis that the brain is used to. There's also headaches and diarrhea. Those three are very nonspecific. They tend to occur early. They tend to get better. And they also tend to be dose dependent. So the more medication, the more milligrams you take, the more nauseated you can be. And similarly, the stronger the headache and the worse the diarrhea. If you get these side effects, not all patients experience these side effects, and if the medications are dosed properly, if you start with a low dose and you give it with food to slow down the absorption, and maybe you divide the dosage as well, you can avoid most of these side effects. Also, the ones that get better the quickest are those three: nausea, headaches, and GI upset. Lethargy and somnolence are also possible with SSRIs, and that occurs when a person is sedentary. So if you're on your feet and you're walking around, you're not going to feel sleepy. But if you are recumbent for a period of time, increasing serotonin can make you feel tired and actually sleepy. Another side effect of the SSRIs, and this is a big one, it's famous, sexual dysfunction. And it's a deal breaker for a lot of sexually active adults. It is not inevitable, but it is very common. Most of the time, there's some degree of it. Sometimes it's not noticeable, and it manifests as three things: anorgasmia, the inability to climax or a delayed climax, or an orgasm that's just not as satisfying as normal, unsuppressed orgasms are. There's a loss of libido due to anhedonia, which is characterized by just a lack of interest. You're not in the mood as much. And it's interesting because sometimes people don't notice the sexual dysfunction they're having because they have a lowered libido, and so they just haven't been thinking about sex as much. And if they don't have a partner, they haven't been masturbating as much. And so when you ask them about sexual dysfunction, they'll deny it, but they're actually having a lowered libido. And I could say that just as a general statement, if you're on a significant dosage of the SSRIs, your libido is going to be lowered. And it might not be lowered enough to cause a problem, but it might not even be lowered enough for you to notice it. And because it's lowered, you might not be noticing it. That's the point I'm trying to make here, is that it's not on your mind. It doesn't occur to you. You can overcome that a lot of times by simply making it a point to be sexually active. And if you have a partner, making it a point that we're going to be intimate on this night, date night. And then once you get started, then you're fine, most people. And so a lot of times that's a good way to get around that particular side effect of just not being spontaneously as frisky. And then the other manifestation of sexual dysfunction is erectile dysfunction, which I think is related really to desire in an otherwise healthy male. Sweating is another common side effect of increasing serotonin, and this takes the form of hot flashes and night sweats. It's not the sweating that is increased with, for example, Wellbutrin, or the stimulants, Adderall and Vyvanse and Ritalin, Concerta, all those stimulant medications. That is increased sweating upon exertion. That's because you've increased norepinephrine, adrenaline. And so if you're exerting yourself, exercising, or if it's hot outside and your body's reacting to that, or if you're nervous, then you're going to sweat more, you're going to notice. But This kind of sweating is related to temperature dysregulation. It's related to the fact that your brain is getting confused and it thinks it needs to cool down when in fact everybody's fine, the temperature hasn't even changed. And so it's very much related to the hot flashes that menopausal and postmenopausal women experience. They experience it because there is a drop in estrogen and they're losing estrogen. And so for them, it's a hormonal change. Serotonin is a hormone as well. It's a neurotransmitter when it acts locally in the brain and the central nervous system, but when it's released and acts at a distance, then it's acting as a hormone. And so it's both, and it does affect temperature regulation in the brain. And so you will experience that, if you experience that, as suddenly you're sweating and you're hot, and you have to fan yourself, but it's still 72 degrees and nobody else in the room is bothered. Or you wake up in the morning and your sheets are soaked. That's night sweats. It's the same phenomenon. It's just that it's happening while you're asleep, and then all of that accumulated perspiration is wetting the sheets. And Effexor, which is not an SSRI, it's an SNRI, serotonin norepinephrine reuptake inhibitor, but at very low doses, it actually is an SSRI. Effexor is the worst as far as night sweats. Weight gain. Weight gain is common with a lot of medications and most, but not all, of the SSRIs. And so, for example, I would not expect any weight gain with Prozac. It's rare with Zoloft, but it's quite common with Lexapro and Paxil, and with Paxil probably being the worst, because Paxil also has anticholinergic actions, which is a whole separate mechanism that causes weight gain. There's a certain serotonin receptor subtype that the serotonin molecule attaches to, and that causes you to have increased appetite. The weight gain is due to increased appetite. It's not due to a change in metabolism. And so even patients who say, oh, but I'm not eating more, they are eating more. They just don't realize it. Akathisia. Akathisia is motor restlessness. It's being fidgety, the knee bouncing or the toe tapping or the squirming in your chair. When it's very intense, you feel very uncomfortable and you have to get up and pace. It's difficult to be seated. It's difficult to sit still. And it has to do with the imbalance between serotonin and dopamine again. And probably the worst one is Prozac in terms of activation and akathisia specifically. And as much as these medications can cause you to feel sleepy during the day if you're sitting down or lying down, they also cause insomnia. Not so much a problem falling asleep, but what's called middle insomnia, and it can happen multiple times. Most people just roll over and go right back to sleep. A lot of times you might not even remember waking up as much as you did, because what it's doing is it's making your sleep more shallow. You spend less time in the deep stages of sleep. Sleep architecture is affected. You may or may not realize that a lot of times people will rationalize, well, I had to go to the bathroom, but that's not what woke them up. It's not their bladder being full that's waking them up. It's being on Prozac or Zoloft that's causing them to have light sleep. They're waking up, and then because they have urine in their bladders, they get up and go void, but that's not what woke them up. They would have slept through the night. If you can't go back to sleep at all, that's called terminal insomnia, and so you've woken up at 3 or 4 in the morning. You don't have to get up until 7, but you can't get back to sleep, and it's the medication that's causing that. And one way to know that it's the medication doing it is that it tends to be like clockwork. Yawning is a side effect that's rarely talked about because I think patients rarely attribute it to their medication, but increased serotonin can cause these intractable yawns that your brain is fooled into thinking it needs to yawn. Now, we don't really know why we feel the need to yawn, but increasing serotonin will cause you to have these great big yawns, one after another, and you keep having them because it's not satisfying your brain, because the serotonin is fooling your brain into thinking that it needs another yawn. And the best way to handle those are to be aware of them and to suppress them voluntarily, which is very easy to do. You can decide to stop, but you almost have to remind yourself to do that until the side effect gets better, which it does fairly quickly. And I think that's why people don't tend to report it. There's a video on that that you can check out. And Lastly, I'll talk about anhedonia. Again, just in general, it can manifest as a decreased libido, but too much serotonin, if you're so chill that you don't get overly worried or angry, irritated, or excited, in the negative aspects, then you also can have a tendency to not get excited just in general. So you're blah if it's too much, and you don't really look forward to anything, and maybe you're not enjoying your hobbies as much. You're not as motivated to get to the gym, to answer your emails, whatever that sense of urgency, whether the excitement is negative, anxiety, worry, or whether the anxiety is positive, which can also be sort of a nervous energy sometimes, going out on your first date or a job interview. If you're just too relaxed, you can lose the ability to cry happy tears, for example, because nothing's upsetting you. SSRIs, serotonergic medications, can kind of take the fun and the zest out of life if the dose is too high. Lowering the dosage is usually sufficient to resolve that particular side effect. So those are some of the side effects of SSRIs as a class. If you're interested in hearing more about any one of those, please check out those videos. And if you're wanting to know which SSRIs are more likely than others to cause some of those, I've got a video on each one that goes into greater detail.